guys, we are here with Dr. James Vlok, and James is a chiropractor. James, thank you so much for chatting to us here at Go Well with Sharon.
Oh, thank you for having me, Sharon.
Believe me, it's my pleasure. Now, chiropractor. What does a chiropractor do?
You mean other than Rick and Plick, you say? Okay. So chiropractic is a profession where we specialize in neuromusculoskeletal medicine. So basically, what that means is we look at the body as a whole. So we don't associate between just treating the spine or just the muscles and the nervous system. Everything is integrated. So in a way, you could say I'm a body mechanic. Okay, so we look at sort of where the dysfunction is coming from. Pain is a symptom of dysfunction, whether it's a trauma or it's mechanical dysfunction. And if something's not happy, it's going to start creating pain. So our job is to figure out where that is coming from, and to then sort of, I suppose in real layman's terms, get the muscle sorted out, realign the pelvis or the spine, get those motion segments in the joints moving nicely. And if you can restore normal functional movement and restore normal biomechanics, that means your pain is going to disappear. And that's really where we come in. It's just looking at, well, what is the problem? What do we need to do? And then also working, obviously, in conjunction with other professions where necessary, biokineticists, physiotherapists. What does the patient need? And then what is the best solution for them going to be?
That sounds absolutely fascinating. Now, as a new patient comes in, what typically can they expect? How would a typical session with you go, especially the first time round?
Well, initial consultation will be a lot to do with the history. Trying to get the clues of where the pain is really coming from. So, what is the history? How long has it been there? What were the causative factors? Looking at their occupation, looking at their training schedule, at their risk factors as well, their age, weight, all those kinds of things. And most of your information will come from the history because it's like being a detective. That's where you get your clues, and then you start looking for your suspects. Then you'll get a full physical examination. You can do the neurological testing, the orthopedic testing, almost confirming what we would already from the history sort of be suspecting would be going on, then try and confirm that, and then do appropriate examinations. We can also refer for x-rays and the blood tests if we do feel that there is something that's really not so happy. We don't have to work through GPs or anything like that, so we can refer directly for any investigation that's necessary. Anything the GP can do from that side, we're allowed to do. And then obviously the treatment. So we will also from our side, we'll do dry needling. We do a lot of the physiotherapy work, the dry needling, and then the mobilization, the manipulation, and then a big part of it is the education afterwards, of trying to say, well, this is why it's happened. I can't say you can't sit in front of your computer every day, for example. So how do we work around that? How do we teach the patient what they can do for themselves that will reduce the risk of the same pattern from coming back? And that's really your typical initial consultation.
Okay, fabulous. Now tell me, in terms of our spines, specifically necks, posture, that type of thing, why should the viewers out there care about typically their spine? Because, for me, being a layman, it comes from the spine, okay, or chiropractors work with the spine and then the peripherals, obviously. But why should we care?
Well, I suppose you should care because you don't want to get pain, and it will reduce your risk of pain, and not just pain, but degeneration. I mean, if your posture is bad and there is dysfunction, that's going to put more strain onto the joints and onto the muscles, and that means that your risk of things like osteoarthritis when you get older is going to be significantly increased. So it's really looking at the long term as well. But if the big thing here is looking after your spine is going to reduce pain. I mean, if you look at the incidence of neck and lower back pain, it is one of the biggest forms of disability in the world. In fact, more work days are lost due to back and neck pain than almost everything else put together if you look at the States and the UK. So it really is a pandemic, shall we say. It's the second most common reason to visit a medical practitioner in the world these days. The most common is flu. So after that, it's back and neck pain. And it's because our lifestyles these days. Technology is supposed to be making our lives easier, but it means we are becoming more sedentary. We're stuck in front of computers a lot more. We're sitting in traffic a lot more. So we are not moving, and our bodies are not as strong as they should be a lot of the time. And that is going to create this whole pattern of back and neck pain. So if you're one of those lucky ones and you just don't get pain, I suppose maybe you don't really need to care that much. But that is the minority. Most people will tend to, at some stage of their lives, struggle with back and or neck pain, and anything that's causing you pain, clearly you should care about.
I totally agree. Now, tell me quickly, what can we as people out there do to alleviate this other than just, always coming to bother you?
Yeah. Well, look, and I always say if I'm treating the same patient for the same problem, then we're not doing our jobs properly. You know, a bit of maintenance now and again is fine and is often encouraged, but that would be a few times a year, and then it should be maintenance. You shouldn't be crawling back in here with the same problem. So it's really looking at the risk factors. You know, what is the patient's occupation? Age is obviously something we can't really change, as well as occupation. So it's looking at their weight, their age, and how do we reduce the risk? I always say it's all about risk reduction. So seeing someone like a chiropractor is a very good start, because I always say that we can get that foundation, get the wheel alignment sorted out. And if we can reduce the muscle spasm and we can get the joints moving properly, that should already help. But then it's kind of getting that patient to stretch their muscles, strengthen their muscles. I often work in conjunction with biokineticists, because I find that the programs that they provide, often for the long term, do more than I can. So it's really looking at more of an holistic approach. You know, we all bring something different to the table. Some patients might just need a bit of mobilization and a bit of maintenance now and again, but you'll often find those patients who are in that higher risk category will tend to need to commit to a program, and that's my biggest hurdle, is commitment from the patient side. People want to get fixed. We live in the age of instant gratification. We want it and we want it now. So it's kind of them to sort of see the bigger picture and the long-term goal here, and then saying, look, we can only take you so far. And often if you really have a stubborn patient, you'll have to say, well, you now have two choices. You either got to do the exercises or commit to the program, or you have to learn to live with a certain amount of pain. And often when you put it in those real blunt terms, you can see the wheels start turning, and no one wants to live with pain. So it's really just getting the patient on board and understanding their problem and understanding what they need to do for their problem. And like any problem in life, if you understand it and you know what you need to do for it, then it ain't that much of a problem anymore.
Well, that's absolutely amazing. So, you, as a chiropractor and as a medical doctor, would definitely advocate that people need to be strong, they need to exercise, obviously within reason. Not everybody is as crazy as I am, but it's exercise very important, keeping that body strong.
Oh, of course, definitely. In fact, it can be the key to the whole process. It's amazing how many patients I'd see again and again for back pain, and we keep fixing them, and then they would discover Pilates, or they would discover whatever exercise they enjoyed. And it's amazing how fewer times you will start seeing those patients. And it really, you can see it again and again. Keeping the body fitter and keeping the body stronger is often the key to the whole process. There's no doubt about it.
Awesome. I really like your approach. And I can definitely vouch for this guy, folks. Believe me, I've been a patient of his for a long time. Now, James, if people want to come and see you, if they do have a problem with their backs, with their necks, with any other referred pains, how do they get hold of you?
Well, they can give me a shot at the practice. They can look me up on Google. We're here in Woomera in Port Elizabeth, the Port Elizabeth Chiropractic and Healthcare. But yeah, just if you look me up, everything is on the internet these days, I suppose. The number is there, and really we've got a great team. We've got biokineticists here, we've got massage therapists, and we really do kind of work in conjunction. So really, if anyone is looking to come and see us, if I'm not here, we've got two really outstanding young chiropractors that are with us at the moment, Dr. LaRue and Dr. Stander. So if you can't see me, definitely one of them would I would hope, help you very much.
Awesome stuff. And then I just have one last question for you in terms of the muscle work, because obviously often, you present with a problem or with pain, as you say, and it's more the muscle than actually the structure. Would you recommend things like massages?
Oh, definitely. I think massages bring a lot to the table, because we do a lot of dry needling, but dry needling is very specific. And you can't needle every single muscle spasm, and especially in a patient that really has got quite a lot. So certainly massages to really loosen up the entire system make a big difference. And your athletes that have got a lot of lactic acid and things like that, then without a doubt, I think going for a good old-fashioned massage now and again can bring a lot to the table.
Fabulous. And you say every now and again, so how often would that be? Monthly?
It would depend on what you're doing. You know, if you've got someone that's doing intense training, like something for Ironman, then yes, I would say something like a monthly massage. Some of our athletes that are really training very, very hard will come in every 2 weeks, for example, and some of them even every week on a build-up to an Ironman. And Kerry Haynes, that's here with us, is fantastic. I must say, she does brilliant work. So yeah, Kerry's hands. I don't know how she does it up to an Ironman, but it would depend on the patient specific and the specific case, and really what they're getting up to and how frequently they would need to come in.
Fabulous. Well, thank you so much for chatting to us. I really appreciate it. It was lovely chatting to you.
Thank you for having me.
My pleasure. And guys, that is it for the show this week. Catch us again next week, same time, same place.